गुड मॉर्निंग एवरीवन। हम हनीमैनियन मंथ जो मना रहे हैं, तो हमें 10 अप्रैल को डॉक्टर रविंदर कोचर को लेके आना था, लेकिन वो आउट ऑफ सिटी होने की वजह से हम 10 अप्रैल को नहीं लेके आ पाए। और 10 अप्रैल को हमने अपना ई मैगजीन रिलीज करा है। आज हम 10 अप्रैल की जगह हमारे कोचर सर, जो हमारे डेयर के पैट भी हैं और हमारे सीनियर मेंटर भी हैं और मेरे टीचर भी हैं, मेरे मेंटर भी हैं, तो आज सर हमारे साथ आए हैं। और टॉपिक है लाइफस्टाइल डिजीजेस। लाइफस्टाइल डिजीजेस में बहुत सारे डिजीजेस आज फॉल करती हैं, जो हमारे रहने सहने से ही, गलत ढंग से रहने सहने से हम उनको अप्रोच कर रहे हैं, डिजीजेस को हम इनवाइट कर रहे हैं अपने शरीर के अंदर। तो सर के साथ वही बात करेंगे। नमस्ते सर।
नमस्कार। तो वेलकम टू दिस स्पेशल क्लास। आज की जो क्लास है इससे पहले डॉक्टर हनीमैन के जन्मदिन की आप सबको बहुत बहुत मुबारकबाद। और दूसरा ये ई मैगजीन जो हम शुरू किया है 10 तारीख को, उसके लिए भी मुबारकबाद। सो फर्स्ट ऑफ ऑल द टुडे टॉपिक लाइफ स्टाइल डिसीजेज। ये इसलिए मैंने आज सुना है कि आज तक हम मेडिसिन तो डिस्कस करते हैं, डिसीज भी इंडिविजुअल डिस्कस करते हैं, और लेकिन डे टू डे लाइफ के बारे में कभी डिस्कस नहीं करते कि व्हाट वी आर डूइंग एज ए फिजिशियन। This is our duty. We will understand the patient as a whole. So to understand the patient, what is necessary, we have to go through his own life, which he just day to day spending, and ultimately that life makes him disturbed. No doubt, Master Honeyman has given us for the classification of disease two words: indisposition and disease. So indisposition, which is given by Master Honeyman as a slightest alteration of the day-to-day life in diet and other things, and ultimately disturbance of their health, which become normal after some time. So that indisposition, basically, when that persists, become regular as a habit, as a regular routine, as a maintaining cause, then that becomes disease. No doubt, World Health Organization consider this lifestyle disease even that particular disease which we are considering as a genetic also. Even he considers, well, WHO considers this thing, diabetic, cancer, hypertension, all the other diseases are also coming under the lifestyle. Why they come under lifestyle when they started from the even genes? He has considered, or the WHO considers this thing. Basically, all the diseases are persisting regular irregularity of the person. So what are the irregularities? Basically, in our life, we are facing three types of the irregularities. First of all, how we are living. What is the way of life, the living style? Now, how we are taking the respiration in this universe. Are these problems which are not normal? And after that, what we are eating. Again, that becomes problem because the eating process, diet, to whom say we are considering as a balanced diet, that everyone is not taking. No doubt, in the universe, every person taking diet according to the availability. But in the availability also, the balanced diet means we have made a chart according to the minerals, according to vitamins, according to the fat, according to carbohydrates, according to protein. We have made the diet as a balanced diet. But we are not taking that. There is irregularity in that, and ultimately the lifestyle disturbs. The third point, how we are living, that is there, but how we are working, what type of the work we are doing. So in today's life, particularly in this modern life, stressful life, tension life, all these things which are due to the modern life, modern achievements, or which are due to the maybe business, maybe routine work, maybe anything, maybe our service to whom we are calling as a service, which we have to do for our earning purpose. But all these things are disturbed. So why I have taken this particular topic? This all lifestyle changes which comes to the person are basically making the person sick. And we as a physician, we must consider them and accordingly we will prescribe the medicine. So for selection of medicine, we also should be like a modern person. As a modern, our patients are modern, they are up to date, and we must be up to date. So no doubt in homeopathy, all the medicines are old medicine even. The medicine which are tested by Master Hahnemann 32, 50 years back, even tested after that, or even the latest medicine which are proved or unproved by the person and given on the basis of clinical experience. So there are so many medicines are there. No doubt we are increasing the number of medicines. We are increasing the medicine according to the disease or giving medicine according to the doctrine of nature also or according to the clinical experience also or according to the individual experience also. So, so many ways are there now we are increasing the medicine. All the original methods which are mentioned by Master Hahnemann are not applicable in these days. That is proving on the healthy person. Since the healthy person is not available, every person is sick. So, to whom we will consider the healthy person and from where we will consider the disease. Every person is normal if they are feeling normal. But since they start feeling unwell, that is the origin of the disease. That may be at the mental level, that may be at the physical level, that may be at the social level. So when the person starts feeling unwell, we consider the disease. So from there onward, when our sora, which is the outbreak of the sora is there, from where the actual disease starts, and ultimately man becomes disease. Man becomes sick, and that disease of converting into the soric, starting from the sora miasm to the syphilitic or to the psychotic miasm, and ultimately even coming as a complicated cases, complex disease, all the miasms are there, sora, syphilis, and psychosis, to whom we are calling as a cancer. So my purpose is this: basically, in this modern life, in this modern style, we must consider the disease in the simplest way to the maximum. First of all, we must consider all the diseases which may be called as a indisposition according to Hahnemann, slight alteration of the body. But this slight alteration which takes place, why that taking place? There is also due to sora, because all the reflexes are due to sora. Sora is the basic cause of everything. Even we are laughing after hearing the joke, and when we are feeling sad after hearing the sad news, that is also due to sora. So all the reflexes, simple or strong, they are due to the sora. So this indisposition is basically also as a disease, but no doubt with a certain time, according to the definition of acute condition, it will go off automatically. You need no need of taking the medicine even. But in day-to-day life, the patients are coming to us and they demand for the medicine. So we have to give him something when he came to us. So what is that? Something we not the placebo, that he will become normal and we will give only the placebo. No, we have to give him something, and for that purpose, first of all, we will consider the first point, that is his diet. Balanced diet, which is not there in the day-to-day life, because we have seen from the childhood, since the fetus or after taking the birth, infant that sucking the milk, that is also not pure. Impurity is there. So many type of adulterations are there. So many rubrics are mentioned there when the child is not sucking the milk properly, or child is refusing, or they is vomiting after taking the milk. So that means that milk is also disturbed. So if that milk is disturbed, so we can consider the life starts from that place, That is the first diet of the person. That is also not pure. So from there onward, whatever we are taking, we are in the first year, when we are taking the milk, when we are taking the other diets, all diets are not pure. Even in these days, we have seen this thing with so many child, they are addicted to certain items. They are addicted to cold drinks or to so many things which we generally not consume when we come to know about the basic things. But the child are taking. They are demanding for so many things. So many candies are there which they are taking. They are not knowing that these all candies are how much harming to them, how much disturbing them, how much making them indecision. So they are not bothering. So their diet is not proper, and the result of that, the growth is not proper. Every day the mothers are coming, they are complaining about this thing. The child is not developing, child is not properly growing, underweight, or the teeth are not proper, or speaking is not proper. Like that, there's so many complaints of the child are there, which are not only from the childhood only, which are basically due to the diet, which we generally say, we are saying that child is taking so many candies, that's why teeth are not good. So that is not one the point. Point is this, why he or she, that child is taking, who is not knowing what this thing, either they are good or bad. So these are the parents who are giving them. So parents are responsible. Not only for the milk, not only for the water, not only for the candy, not only for the so many soft drinks, but for so many routine diets also. What they are giving to them. Every parents child demands and they are saying we are giving them. बच्चा रोता रहता है ये क्या करें, जिद करता है देना ही पड़ती है. So what is the excuse of the parents? So that means the parents are worrying about their child's health, but simultaneously they are worrying that they should not demand also. So why they are not demanding? They will demand because they are the child. But this is your responsibility. You should give them or not. So like that way, so many points are there which are basically in the lifestyle, but starting from the diet onward, where the parents are responsible. And when the child grows and develops, now he is now demanding so many things which are the other players are taking. So he is going after the play, or they are demanding the things he can they are demanding the things due to their competition. Others are taking, I should also take. Others are liking this thing, I should also take. So like that way, now all the fast food which are available in the market, all the childs are taking in the early age of the childhood when these all things are not required, but they are demanded. So you can consider that thing, how the complaints are coming up when we are not taking the proper diet. All diets are not only the poisonous, but even in the minor case, if the child or the person is taking in less quantity also, that also causes them harm. We are every day hearing about this thing, कि मैदा पेट में भरा पड़ा है जी. We are taking the maida every day. So what is that maida? What are these breads and butter what we are taking? They are not properly. In old time, people are taking proper wheat, atta properly there, everything was there, that is digestible, fibers are there, that is also digestible. That not only makes the person digestible thing, but even the proper thing, nutrition is there. But now in these days, we are not taking the fibers, we are taking all these bread and other things, which are having only the matter, nothing else. And ultimately, that is harming the body. Indigestion is there. Not indigestion, there is gas formation, there is acidity, there is fermentation there. So many complaints are there. So like that way, the lifestyle is disturbed. Not only in the childhood, we are taking the same type or doing the same type of mistakes in our young age. In young age also we have seen this thing, what they are taking. People are taking, or the young people are taking so fast food, so dieting, so such type of candy which are making them stimulant. Because they are feeling stimulant, they need some stimulants, and they are taking stimulant in some such a way where the parents are not able to know what they are taking. No doubt, in the presence of the parents, they are not taking tobacco, they are not smoking, they are not drinking. But in other words, they are taking the chocolates and chewing and so many things which are having the same thing. They are the product of the same caffeine. They are the product of the same narcotics. So ultimately, even in the presence of the parents or parents giving them in happily, yes, you should take this all chocolates and all these things, what they are. So ultimately, in everyday life, we are seen in step by step. Every time our diet is not proper. Why I am telling you? Because all these diets are disturbing you. Total indigestion, total digestive system is disturbed. Not only the digestive system is disturbed, even fatty liver, even spleen enlarged, even the intestines are enlarged, ulceration in the stomach or in the gastroenteritis problem due to the pollution. All pollutions are there, you know. No doubt in ancient time we consider this thing the water pollution is there only. So water is not only polluted now, now everything is polluted by every way. And we are taking all the things which are polluted because they are making us happy. So we feel enjoy after taking all these things. So enjoyment is the basic target, but we are not considering what we are taking. What is that? So all these are the basically problems. So this is the one way how the life is disturbed. So I am telling you only thing as a doctor, you must pay attention to all these things. So if you want to cure, it is better make his diet as a balanced diet, regular diet, and proper diet so that all these things can be cured with the help of medicine, even without the help of medicine. But we have to give to the patient medicine whenever there. There are so many medicines are there. I am just telling you one line only, which he mentioned in the alloy. There is starting disturbance of the metabolic system due to the overdrugging. So what is this overdrugging? Not only the allopathic drugs. No, we will not claim them. The people are taking the allopathy drugs, that's why their system is disturbed. Even the thing which they are taking in as the form of as a imbalanced diet or as a polluted diet, so their system is disturbed. So whenever there is disturbance of the system, metabolic system, person is not able to digest the thing, one person is not able to even have a proper diet, balanced diet, suffering from the gas formation, fermentation, acidity, indigestion, low emotion, ulceration, so many things are there. So due to the diet, spicy foods, due to all the things, fast food, which they are taking every day, all these things are also in other form. Don't consider that drug is a drug. These all are also drugs. In other words, because they are disturbing the system. And when the system is disturbed and metabolism is disturbed, in homeopathy, you can give aloe. No doubt you can give the naxonic also, which we consider the thing after taking the otherwise fast food and the stimulants and other folic substances, so many things we can use the naxonic also. So there are number of medicines mentioned which are due to the irregularity of the diet or the disturbance of the diet. So as a whole, what I mean to say, this is the one part, how the person becomes basically diseased, but no doubt starting from very simple word indisposition. From where he saying, whenever I will take particular thing, I feel disturbance. Whenever I will take cold, I feel sore throat. Whenever I will take anything, sour thing, I feel sore throat. Or there is coffee there is cold pressure there due to all these things. Or even digestive problem is there, respiratory problems are there. All these things are related to one part. The second part is basically the way we are living. That is the most important. You just imagine in these days, I'm just talking about last 25 years, how many people are changed their lifestyle, where they are living every day, have they changed their living room? or have they changed their bed? Have they changed their style of living or lying on the bed? Have they changed the sleeping style? No. Every day we are going on the same bed in the same way, same style, same thing, and same room. So from last 25 years, when we are in the same room, that room which we are not knowing how much pure that is not pure at all. There is no oxygen at all because everything is closed. All the windows are closed, gate is closed, everything is closed because you want to be as a disciplinary person and secret person. So you don't want to be disturbed by anybody. So you are not even opening the door of the room. You are not opening the windows of the room. Even air is not coming to the room because AC are there. Modern life is there. So due to the all AC and all these things, you have completely closed all the walls of the room and living in the same room for not only 1 or 2 days or 365 days. So imagine when you are living in such a dangerous room, I will say, no doubt we are considering this thing. Whenever I will go somewhere in the guest or some tourist place, I feel very good. I feel comfort. There is no problem with last 10 days when I stayed there, no problem by there. So when I came back to my room, the same problem starts, same old story there. Why this same so old story there? Because you are living in the same room. You are not making it fresh. You are not making it correct. You are not making it pure. The cleanliness or the done by your sweeper or the person, those are the lady which are sweeping, cleaning the rooms. Just imagine, they are using no doubt every day antiseptic or anything which you are using. But what is that? That is also the poison. Day by day, that poison is there. Now all the things which you are using every day in your room, where that goes, that smell goes, because nothing is coming out, everything is closed, and nothing is going in. No cross ventilation is there. So just imagine, all these things are disturbing you. But how they are disturbing you, you are not able to know. When they are disturbing you, no. That is also one type of chronic disease. Slowly, you are going to develop a one new disease which you are not knowing. And that disease is your room. That disease is your bedroom. That disease is from the bedroom. So can you imagine when you are living in the same atmosphere every day and for not only 1, 2, 3, 4 hours, but for 1/3 day of life. 1/3 day of life you have to spend there because you have to sleep there. So 1/3 time you are spending there, 1/3 time you are spending in your office, and 1/3 time you have the work and all the things to do the other work which you are not doing. Living in the same bedroom. Whenever you are coming to room, you go straight to the bedroom. You don't want to even sit in your drawing room. You don't want to sit in your garden if you have anything. Because we are all a habit of going straight way to our bedroom. So all these problems are there. So that is the one side which is the common. And second is the posture. In the bedroom, 90% people they never change the posture. Whenever they go and sit in the same style and see the TV for 2, 3, 4 hours or the news, whatever they like or anything. But for 3, 4, 5 hours, they are sitting in a one posture. That posture, no doubt, not disturbing you in a day or two, but that posture disturbing you when you are doing regularly. That becomes maintaining cause. So you are suffering from cervical spondylitis. You have some pain in the back. You have your backache or spondylitis or any other problem in the bones. You have the problem in the knee joint or elbow joint or shoulder joint. Why? Because you have the posture like that. That posture which is disturbing you. You don't want to change because exercise is not done by the people. That is the problem. So every part of the body, all these joints, all these bones, everything wants to be moved. All joints should be in the movement, but we are not moving them. We are just sitting in the same way, in the same style, in same room, in same bedroom, and same pillow, and same everything is there. So just imagine, all these same are basically disturbing. Whenever anything in the same, you will be disturbed. Don't feel happy. Okay, you are in your room, you are in your bedroom. I feel comfort. No, you are feeling comfort for a time, but that making you sick and causing a certain disease in you, which are called as a backache, very prolonged thing. Cervical spondylitis. So now for cervical spondylitis, I am adding one, two more words are there. Now in these days, people are having to habit of using the mobile and the laptop and other things. So same problem. So all these cervical problems are not due to the disturbance of the roads or the use of the bike, but are due to the mobile, laptop, and TV. So all these things are basically in the this spondylitis is due to modern life. So like that way, there are so many diseases are which you are not knowing how they are or how the person become victim. But person is coming to us. We have to give them medicine, but we have to manage the case also, advise them also not to use all these things or minimize these things or eliminate all these things so that you can feel comfort. Otherwise, though you have given the best medicine, you have given the Rostox or Posticum or whatever the indicated medicine, but that will not help the patient until unless he will not change his posture. So this is the general lifestyle which is there. These are the diet and the lifestyle. These are the common things which people are not knowing. If they are becoming victim due to all these things. But one, no doubt, third thing is there, where they are considering, yes, this is due to my tension. They are coming with this way. मुझे टेंशन बहुत है, मुझे टेंशन रहती है, वो है like that way. Every day they are thinking. But tension is not again the thing which disturb you. The work which you are doing, that is not only disturbing you. The mind which you are using every day, that is not disturbing you. This mind, if you use in the maximum, that becomes good. But the problem is this, we are not using in the proper way. We are just stressing the mind for a one purpose only, in the for same purpose only, and for those things to whom we no need to think. Why we are thinking such things which are not going to be happen or which are going to be happen, but you are not knowing what is the harm of that. ऐसे ना हो जाएगी, हम जा रहे हैं रास्ते में एक्सीडेंट ना हो जाए. और वाई यू आर क्लेमिंग दिस थिंग इज एक्सीडेंट होगा ही होगा. This is not the condition. If you will ride properly, if you will drive properly, there is no chance of accident. If the driver is proper, there is no chance of any accident. But the thing is this, you presume and you are sitting on the back seat and thinking what this thing. Oh, accident ना हो जाए, oh, accident ना हो जाए, सबर करना है मैंने, नुकसान ना हो जाए, वो ना हो जाए. What is the thing? Why you are thinking about these things? Like this way, you have such type of tension which are not for your tension, not for the purpose of your tension, but you are making them. लॉस ना हो जाए, बिजनेस लॉस ना हो जाए. बिजनेस कर रहे हो, लॉस भी होगा, प्रॉफिट भी होगा, all these things are there. This is must. But the thing is this, every business will not be done all the 365 days. Even that business which is for the day-to-day life, that is also not for 365 days. उसके बीच में भी घाटे बढ़ते आते रहते हैं, प्रॉफिट एंड लॉस होते रहते हैं. We have to manage the case, we have to balance the thing, we have to save the money for the future. And saving the money for the future is good thing. But only saving the money for the future, not for the present, or disturbing your present due to the future, that is the problem. And we all are basically having the one type of tension that we are suffering, not for the present complaints, but suffering from the future complaints, which may or may not come. मुझे कैंसर ना हो जाए, मुझे वो ना हो जाए, मुझे वो ना हो जाए. So why you are thinking in such a way? So such type of the problem which you are unnecessarily thinking, or the people are thinking and coming to you. So that is not one mental symptom. Thinking about the cancer and I will think I will be covered by the cancer. Give him करके दिएगा. No. This is the common mentality of the person. Every person is thinking about the future and not about the future, but of the future, which may or may not happen. But we are having the habit of these things. This is the habits. So habits are not basically the thing which you have made yourself, but you have done all these things due to your people, yourself, and by the other people surrounding you, which are guiding you to be like this way. ऐसे ना किया करो, ऐसे ना हो जाएगा, बाहर ना जाया करो, वहां जाकर के वो क्रिमिनल बहुत हैं लोग आजकल, बड़े लोग हैं जो मोबाइल खो लेते हैं, बड़े लोग हैं जो स्नैचर हैं, बड़े लोग वो हैं, तो उन चीजों को सोच करके हम लोग दिस विल हैपन विद मी आल्सो, दिस विल हैपन टू यू आल्सो ओनली, इज नॉट द थिंग. So why you are thinking about this way? Just go easy way. You can make yourself relax, not to take all these things with you. But you should not go out because anybody can, or snatcher is sitting our life unnecessarily by those things which may or may not be going to be happen. But we are thinking that is there. So that's why this type of tensions are not required. You should have a tension because you are doing work. Tension must be there. Everybody wants to progress. Everybody has to develop, and everybody wants to be achieve everything. If you want to succeed, so for succeed, there is need of tension. You have to think. You have to plan. But planning should be in a way that is not causing tension to you. Planning a thing that will make you easy. You should plan the thing in such a way that makes you easy, not disturbing your mind, not disturbing you, causing your body, or making you as a hypertensive patient. So basically, in this lifestyle cases, what I have seen, whenever the patient comes, so many times the patient, they are not suffering from the actual disease, but they are from the indisposition, which no doubt we are not considering because this might be a mild case. Indisposition may be a slight alteration, but this slight alteration is due to the regular habits of the person that is going on every day. Alteration is there, and ultimately every day they are doing the same thing, which is making them alter. And ultimately he becomes a diseased person. So this becomes as a maintaining part. So for the exciting cause and for the maintaining cause, the treatment is mentioned by Master Hahnemann. Was mentioned by Master Hahnemann 250 years back and still applicable. That is, you should not give any medicine, no need of medicine that will go off. Just check or avoid the exciting cause, avoid the maintaining cause. Change the lifestyle, and ultimately you will be normal. You mean all the patients become normal, not the doctors. We as a doctor person, we will hear the patient and try to find out if there is need of medicine or not. If there is no need of medicine, it is better advise him and you get the therapy from the patient by consultation fee. No problem. Because we are advising them, we are giving them the good choice, proper way how to live, proper way how to eat, proper way how to gain your weight and diet and make the health, proper way how you will proceed person, how you will succeed. All the other persons who are called as a consultant, if they are charging, you can also charge from them. Don't think a medicine should be given and then I will charge. No. Medicine is not only the thing from where we will charge the pay from the patient. You can give a consultation fees and charge. No problem. So consultation fees charging from the patient is not bad, but if you are giving the proper advice, sincere advice, as a physician advice, as a good health maintenance type advice, then there is no problem. No doubt, we are a material person. We need something to give him, and after that we will charge. In that case, you can give the placebo. That is the only thing which patient is not knowing what is that. You just give him one vial of the glucose by putting some drops of the medicine, not medicine, but alcohol, and ultimately just he will feel the taste and he will feel some as a materialistic growth. I have taken something, the doctor has given me something, now I will be all right. So, okay. So, but my purpose here in today, I am saying one thing. Hahnemann has started the disease not from the disease itself, but from those things which is not the called as a disease, which to whom he used as a indisposition, and what is indisposition is all due to the disturbance of diet, lifestyle, and the modern way. Please keep in mind, we will treat the patient from that way onward and see the best style, best way to give the best to the world. Thank you very much.
थैंक यू सर। थैंक यू सर। सर जो मेडिसिन बताई है ऑडियंस सर ने लाइफस्टाइल चेंजेस के लिए कि प्लेसिबो यूज करना है, वो ऑसम था। उसको अपना लाइफस्टाइल बनाना।
यूज ऑफ मैक्सिमम प्लेसिबो।
बिल्कुल सर, वो अपना लाइफस्टाइल भी बन सकता है कि पीएल दो बस, लेकिन सिर्फ लाइफस्टाइल चेंजेस के लिए, सिर्फ एडवाइस करने के लिए। डिजीज को तो करना ही पड़ेगा ट्रीट, वहां पे दवाइयां देनी ही पड़नी है।
नहीं, दवाइयां दो, but that medicine name is not there.
बिल्कुल।
Name of the medicine you should keep in mind. Maybe as a X by Z, or maybe as a 1, 2, 3, maybe as a 5, or maybe as a 25. No problem. But that medicine should be not nux or not aloe or anything else.
हाँ जी ऑडियंस,
Okay.
कोई क्वेश्चन किसी का? सर अभी हमारे साथ है, एनी क्वेश्चन रिगार्डिंग द टॉपिक, या सर से कोई और बात करनी हो, मेरी शिकायत लगानी हो किसी ने? कोई शिकायत नहीं, आज मैं सुधर गई।
शिकायत कोई नहीं लगाने वाला, शिकायत तो सीक्रेट होती है। You should keep the box, suggestion box and the complaint box. So then you will
So, sir,
yes,
to have
yes.
one question, sir, if you allow me to put you one question, sir.
हाँ जी श्योर सर।
हाँ जी, how to manage according to my the requirements of modern lifestyle as a healthy lifestyle, how to convert this modern lifestyle which is injurious to health into a very healthy lifestyle suggestion.
Basically, what I am suggesting to my patient, it is better to just change the place once a week. So, and that way, whenever you will go, just please listen, very important point. What you are demanding basically, that is the thing, how we will change our lifestyle. Lifestyle change means not going anywhere in the tourist place, not going in the religious place, not going anywhere where you are not, you have to spend the money. But the lifestyle you can change in your home also. At your family, you can say, once a week we will change our rooms, bedding rooms, and we will be guests in our home. आप अपने घर में ही गेस्ट हो सकते हो। आप एज ए सीनियर पर्सन, इफ आई एम एज ए सीनियर पर्सन, आई विल से टू माय चाइल्ड कि आज मैं आपके घर में गेस्ट हूँ, आज मैं कोई काम नहीं करूंगा, आपके घर में गेस्ट हूँ, जो भी आप मुझे खिलाओगे पिलाओगे, जो भी कुछ करोगे वो करूंगा। आई विल सिट आइडियल एंड आई विल नॉट डू एनीथिंग। सेम वे यू विल कॉल देम आल्सो once a week or twice a week. आप मेरे घर में आओ, that means the same home. Home is same, but now they will not work. You will work for them. उनको मालूम होना चाहिए कि आपके पेरेंट्स आपके लिए काम कर रहे हैं और बहुत अच्छा काम कर रहे हैं। उन्होंने हमें जो कुछ आज खिलाया पिलाया है वो हमारे लिए बहुत ही अच्छी बात है। So like that way you can change your lifestyle. So you can change your lifestyle in the business also. अपने बिजनेस पार्टनर को भी बोल सकते हो कि आप जो काम कर रहे हो आप वो काम करो। जैसे बैंक में सर्विस करने वाले लोग हैं, बैंकों में ड्यूटी होती है, वो हफ्ते के बाद में ड्यूटी चेंज कर देते हैं। भाई दे आर चेंजिंग, कि एक आदमी एक ही पोस्ट पर बैठे बैठे फेडअप हो जाता है और उसके बाद में उसकी गलतियां होनी शुरू हो जाती हैं। तो मैनेजर क्या सोचता है कि अब ये इस पोस्ट से फेडअप हो गया है, इसको पोस्ट चेंज कर देनी चाहिए। तो अल्टीमेटली दे आर चेंजिंग इन द सेम ऑफिस, देयर प्लेस। अब वो नई पोस्ट पे बैठा हुआ और नए ढंग से सोच रहा है कि मेरी पोस्ट अब ये है, अब मैं कैशियर नहीं हूँ, अब मैं दूसरे ढंग से क्लरिकल साइड में हूँ, या क्लरिकल से कैशियर में बन गया हूँ, लाइक दैट वे। तो बेसिकली गिविंग द नेम टू अ पोस्ट एंड यूजिंग थ्रू द लाइफ दैट वर्क, दैट मेक्स यू फर्क। रेगुलरिटी ऑफ एनी वर्क, आप हर रोज एक ही काम कर रहे हो, हर रोज ये वही जा रहे हो, वहीं पर जा रहे हो, आप ऑफिस में जाते हो, एक ही पैसे है आपका। आपने कभी 25 साल में चेंज किया है कि आपका रास्ता जो चेंज हो जाए? नहीं। और लेकिन आप अपने करते हो, किसी बेटर हो सकता है कि रास्ता चेंज करने के थोड़ा सा लंबा है, फिर रास्ते जाकर देखो तो देखो एंजॉय होगा, उसमें अच्छा लगेगा आपको कि आज वो लाइफ नहीं मिली, भाई वो लोग नहीं मिले जो लोग रोज मिलते थे। आज नए लोग मिले हैं, आज किसी नए आदमी से राम राम हुई है, सत श्रीकाल हुई है, आज नए आदमी को देखा है, तो उससे आप एंजॉय करोगे। तो है तो कुछ ही नहीं बात इसमें, लाइफ तो सिंपल है, लेकिन हमने लाइफ को टफ बना रखा। आप अपनी लाइफ में, नो डाउट कुदरत ने भी कहा है चेंज ऑफ लाइफ इज बेटर, और चेंज चाहिए भी। लेकिन चेंज का मतलब ये नहीं है कि हम इस तरह से चेंज करें कि हमको नुकसान हो जाए। मैं आपको बिजनेस चेंज करने के लिए नहीं कह रहा हूँ, बिजनेस में वर्क चेंज करने के लिए कह रहा हूँ, उसका पार्ट एक है जो चेंज करने के लिए कह रहा हूँ। कभी आप अपने सबॉर्डिनेट की चेयर पर जाकर के बैठ कर देखो, कभी आप उस काउंटर पर जाकर बैठो और जहाँ पर पब्लिक कंप्लेन कर रही है और सुनने की कोशिश करो, और वो देखो क्या करते हैं, तो यू विल फील एंजॉय। आपको मालूम पड़ेगा आपके व्यक्ति की कंप्लेंट्स क्या है, जो आपका जो सबॉर्डिनेट है सुन रहा है और वो आप तक बता नहीं रहा है, तो डायरेक्ट क्यों नहीं आपने कंप्लेंट सुनी? तो यू कैन डेवलप योर पर्सनैलिटी आल्सो इन दैट वे। तो दीज आर द वे। सिर्फ ये है कि लाइफ स्टाइल को थोड़ा सा चेंज करने की जरूरत है। 24 घंटे चेंज करने की जरूरत नहीं है, 24 घंटे में 8 घंटे भी चेंज कर सकते हो, 4 घंटे भी चेंज कर सकते हो, पर लेकिन ये है कि कभी कभी अपने बच्चों के साथ भी खेलो, कभी अपने पोते के साथ भी खेलो, पोती के साथ भी खेलो, कभी किसी के, आप अपने बुजुर्गों के पास भी बैठो, कभी उनसे भी बातचीत करो, कभी उनकी भी कहानी सुन लो, तो अच्छा लगेगा। लेकिन हम लोग नहीं कर रहे हैं। एवरीबॉडी कमिंग टू देयर होम एंड स्ट्रेट वे गोइंग टू देयर बेडरूम, और इमीडिएटली क्या होता है, वो बेडरूम में पहुंचता है और पीछे उसकी घरवाली पहुंच जाती है, और जाते ही उसको हालचाल तो पूछना नहीं है उसका, क्या हाल है, कैसे हो, थकावट है, कैसे हुई है, वो दफ्तर में थक गए हो गए, काम हो गया होगा, ये तो बात बात की है। पहले कंप्लेंट शुरू हो जाती है कि आज बच्चों ने पढ़ाई नहीं की, आज उसने पढ़ाई नहीं किया, आज ये नोटिस आ गया, आज वो नोटिस आ गया। तो बट आप थिंग्स आर देयर, एवरीथिंग इज डिस्टर्बिंग यू, तो जस्ट चेंज योर लाइफ। कभी आप अपने रूम की जगह किसी और रूम में भी इंटर करके देखो, आपको मालूम पड़ेगा कि वो रूम क्या है, वो रूम आपके रूम से कितना अच्छा है, कितना माड़ा है, क्या चेंज आ रही है उसमें, क्या डिस्टर्बेंस है, क्यों नहीं उसको ठीक हुआ, क्यों नहीं हो रहा, उसकी प्रॉब्लम क्या है। तो आप दोनों की प्रॉब्लम को शेयर करोगे, अच्छी हो जाएगा। सो वी हैव टू एडवाइस टू द पेशेंट इन सच ए वे दैट he or she can do all the things, but the thing is this, we have to just make them understand that these are not the problem for your health, but this is the problem for your overall disease, and your disease will be all right if you will do all these. Okay.
सर एक क्वेश्चन है चैट बॉक्स में कि इन केस ऑफ ओवरलोडिंग overdosing drugs, a lower nux in which potency?
Nux, which potency? In case of
Over,
nux,
overdosing of drugs हो जाती है जब, तो a lower
overdosing,
nux किस potency
overdosing,
में?
any overdosing of medicine, you should start from 200 onwards.
Any other question? Please come forward.
Whenever you are giving any NSAID, any medicine which considered as an antidote to the your overdosing of medicine, you should start from 200 onwards.
Sir, I want to ask one question.
हाँ जी।
Sure.
Sir,
सामने आ रहा है? नीतू वीडियो ऑन करो बेटा।
हाँ, क्वेश्चन
On
क्या है?
me. Sir, our social media is loaded with so many suggestions on diets, keto diet, without milk diet, with milk diet. Regarding gym also, there are so many videos which is confusing the teenagers. So what type of suggestion we should give there?
Basically, social media or everybody is interested that everybody should be healthy person, and
हाँ
for
जी.
that they are giving the advice to the others. But the point is this: कि we are giving advice to the others, but not working as a own person. So it is better as a doctor, we should not only take all those things which should be good for the health, but we are advise also. So there is generally one saying कि एक सेंट के पास किसी को बच्चे को उन्होंने कहा ये सिगरेट पीता है, इसको सिगरेट छोड़ने की हैबिट कोई ऐसी बताओ ये सिगरेट छोड़ दे या आप इसको एडवाइज करो। तो वो सेंट ने कहा कि आप 7 दिन बाद आना। तो 7 दिन के बाद जब वो गया तो उसके सेंट ने उसको एक एडवाइज किया कि यू शुड नॉट डू दिस थिंग, और वो बच्चे ने बात मान भी ली। तो उसकी मदर पूछती है कि आप ये बात तो 7 दिन पहले भी कह सकते थे। कहता नहीं, 7 दिन पहले मैं पी रहा था इसलिए मैंने इसको
Okay.
कहा, तो बता नहीं सकता। आज मैंने वो छोड़ दी है, मुझे मालूम है कि मैंने छोड़ दी है, और आई कैन डू दैट कैन आल्सो। तो कहने का मतलब ये
Okay.
होता है कि एडवाइस जो देने के लिए भी आप साउंड होने चाहिए। हमारा सोशल मीडिया क्या कर रहा है, एक दिन एक एडवाइस देता है कि दिस थिंग इज गुड फॉर द डायबिटिक, नेक्स्ट डे एडवाइस दिस थिंग इज गुड फॉर द डायबिटिक, थर्ड डे दिस थिंग इज बैड फॉर द डायबिटिक, सेम थिंग इज बैड फॉर द, वो एवरी
हाँ
डे
जी.
चेंज एनीथिंग। तो उसके लिए मैंने ये कहा हुआ है कि इट इज बेटर कि आप रोज गार्डन जाओ और एक एक पत्ता डेली खाते रहो, कुछ ना कुछ तो आपको डायबिटिक ठीक होगी होगी। तो ये
ठीक.
बातें नहीं, बात तो ये सोचनी चाहिए कि लीव्स आर नॉट द मेडिसिन, ट्री आर नॉट मेडिसिन। वहां पर कौन सा बूटा है जो ऐसा है, जो प्लांट ऐसा है जो आपको शुगर को ठीक करता
Right,
है।
sir.
हर रोज मैं तो रोज गार्डन जाता हूँ, सैर करने जाता हूँ, वहां पर पत्ते खा लेता हूँ, मेरी शुगर ठीक हो गई है। ये कोई मेडिसिन नहीं है और ये कोई एडवाइस नहीं है। आप हम लोगों की प्रॉब्लम क्या है, बीइंग ए फिजिशियन आल्सो, कि हम लोग खुद कुछ करते हैं पर लेकिन बताते कुछ और। तो व्हेन यू बी लाइक दैट वे, व्हेन यू हैव सिंपल लाइफ, यू आर हैविंग ए वेरी सॉफ्ट लाइफ, आपकी सात्विक लाइफ होगी, खाना पीना आपका सात्विक होगा, देन यू कैन एडवाइस टू द पेशेंट आल्सो। वो जा बोल्डली कह सकते हो।
हाँ जी.
आज से 40 साल पहले जब मैं एडवाइस करता था ना लोगों को वैक्सीन के बारे में, तब मैं ये कहता था कि मैंने अपने बच्चों को कोई वैक्सीन नहीं करवाया, मैंने सिर्फ
हम्म.
होम्योपैथी दी है। तो उसका
Okay.
इफेक्ट पता होता था। पर लेकिन ये जब मेरे पोते को वैक्सीन लगा हुआ, मैं कैसे रोक दूं किसी को?
हाँ जी.
तो ये इफेक्ट होता है। अल्टीमेटली जब आप बोल रहे होते हैं, अगर आपने वही गलती की हुई है तो आपके बोलने के स्टाइल में उतनी पावर नहीं होगी।
हम्म.
पावर तो तब होगी जब आप भी प्योर हो, जब आप भी
Right,
सात्विक
sir.
हो, आप भी ठीक हो।
Right,
यू
sir.
यू गॉट द आइडिया? तो ये
हाँ जी.
बातें सोशल मीडिया में ये नहीं हो रहा है। सोशल मीडिया खुद तो क्या कर रहा है वो तो बता नहीं रहा।
हम्म.
कपड़े पहनो, ये दूसरों को कह रहे हैं, और फोटो में वो दिखा रहे हैं जिसमें कपड़े पहने नहीं।
हाँ
एडवाइस
जी.
किससे कर रहे हैं? जो फोटो नहीं पहने।
हाँ.
तो जो फिल्म इंडस्ट्री वाले स्मोकिंग के लिए एडवाइस करते हैं या उसके लिए करते हैं, ये जर्दा खाना नहीं अच्छा है, वो नहीं खाना अच्छा है, तो खुद क्या करते हैं
खुद
लोग?
तो सब
क्यों ये वी डोंट वांट एक्सपेक्ट फ्रॉम दिस थिंग। हम नहीं चाहते हैं कि अमिताभ बच्चन किसी बीड़ी सिगरेट की ऐड करे, क्योंकि हमारे दिमाग में अमिताभ बच्चन एक सोशल आदमी बना हुआ है, और सोशल आदमी वो भी जो स्मोकिंग नहीं करता
हम्म.
है। तो स्मोकिंग की ऐड देनी शुरू कर दे तो क्या वो लाइक हम पसंद करेंगे? नहीं करेंगे।
नहीं.
उसी
नहीं.
जिस आदमी ने भगवे कपड़े पहन रखे हैं, संत महात्मा है, और वो आपको कोई चीज खाने के लिए बोले तो आप उसको अच्छा समझोगे? तो हमारे दिमाग में जो एक इमेज बना हुआ है एज ए डॉक्टर, आपके लिए बना हुआ है कि आप डॉक्टर हो, आप जो भी एडवाइस
हम्म.
करोगे, अच्छी डाइट एडवाइस करोगे, वो नीट क्लीन होगी, आप वाइट कॉलर हो, वाइट कोट हो, तो आपको उसी ढंग से लोग पसंद करते हैं।
हाँ जी.
तो जब आपको पसंद करते हैं उस ढंग से, तो यू शुड बी लाइक दैट।
राइट.
दिस इज द पॉइंट।
थैंक यू सर।
एडवाइस देने के लिए एडवाइस देना सिंपल है, नो डाउट, पर लेकिन एडवाइस देने के लिए एडवाइजर बनना अच्छा नहीं है। वो अच्छा तभी होगा जब आप प्रॉपर वे चलेंगे।
खुद फॉलो करो।
मैं अपने बच्चों को, स्टूडेंट्स को जो बातें करता हूँ यहाँ पर, उनमें यही बातें होती हैं। मैं वो बात कहता हूँ जो मैं करता हूँ, क्योंकि मुझे
हम्म।
मालूम है कि असली वो का बात करेगी जो मैं कर रहा हूँ, दूसरी नहीं करेगी।
हाँ जी।
ये इफेक्ट होता है,
राइट
इसलिए
सर।
इफेक्ट होता है बस।
थैंक यू
तो
सर।
सर अपना भी सर बताइए कि आपने अपनी लाइफ को किस तरह से, लाइफस्टाइल को बेहतर करके हमारे लिए भी एक जबरदस्त बात हो जाएगी।
हाँ, ये तो है ही है, वैसे होता है। मैं आपको बताऊँ, जैसे मैंने अपने आप को बता रहा हूँ, मैं सात्विक भोजन खाता हूँ। मेरे भोजन में कोई फास्ट फूड, कम फास्ट फूड है, और कोई भी ऐसी चीज नहीं है जो जिसको हम कहते हैं, जैसे चलो नॉन वेज भी है, कोई नशा भी है। मैं कुछ भी नहीं लेता हूँ। तो मैं किसी को भी एडवाइज कर सकता हूँ ये बातें अच्छी नहीं है, क्योंकि मैं खुद भी नहीं लेता हूँ। मैंने तो टेस्ट भी नहीं किए हैं बहुत सी चीज़ों को। तो स्मोकिंग मुझे मालूम ही नहीं होती क्या है। ड्रिंकिंग के बारे में मुझे भी मालूम है इस टाइम से। इवन वेजिटेरियन हूँ, प्योर वेजिटेरियन हूँ। व्हेन आई एम गोइंग इवन अवे फ्रॉम द कंट्री, बाहर भी जाते हैं, फॉरेन भी जाते हैं, तो हम प्योर रहते हैं, कोशिश करते हैं कि फूड पर ही रह जाएं। तो इस ढंग से जो बातें हैं जो हम अपनी लाइफ में अगर कर सकते हैं, मैं अगर 30 साल से 35 साल से कर रहा हूँ और 40 साल से कर रहा हूँ, और मुझे कुछ नहीं हुआ और मेरी सेहत को कुछ नहीं हुआ है, तो आपको क्यों होगा? आप भी ठीक होंगे अगर आप सात्विक भोजन खाओगे तो, और अच्छे ही होंगे।
सर आपकी रूटीन क्या है खाने की? फल खाते, कोई विटामिन लेते, विटामिन डी लेते, कोई शरबत?
ऐसे है ही, विटामिन थेरापी, मिनरल थेरापी, जो भी आप जो कहते हैं, या डाइट, बैलेंस डाइट के बारे में, ये चीजें कब लेनी है? अगर मेरे सिस्टम में कोई ऐसा डिस्टरबेंस आ गई है जिसके बाद में खाते पीते भी वो ठीक नहीं हो रहा है, देन आई हैव टू टेक दी। अदरवाइज आई शुड बैलेंस माई डाइट अकॉर्डिंग टू द डाइट।
जी जी।
विटामिन लेने की जरूरत नहीं है। हम मैं हम कभी कोई विटामिन नहीं लेते हैं, हम कभी कोई मिनरल, वो ऐसा कोई एक्स्ट्रा मिनरल नहीं लेते हैं। मैं रास्ते में कोई चलते हुए कोई, ये आप जो कहते हैं, ये उसका पानी पी लो, उसकी चीज खा लो, हम कोई ऐसा नहीं लेते हैं। कोई हम वो रात को किसी टाइप को कहते हैं, जिसको आजकल लोग बनाते हैं, काढ़े बनाकर भी पीते हैं। हम कोई काढ़ा नहीं पीते हैं। सात्विक लाइफ है, सिंपल पानी पीते हैं 6 7 8 बार दिन में, 2 3 बार चाय पीते हैं, यही लाइफ चल रही है। ब्रेकफास्ट लंच डिनर वो टाइम से वो लेते हैं, और चाहिए भी क्या।
जी
हेलो।
जी। जारी रखें सर, जारी रखें। बड़ा अच्छा
हाँ
बता रहे
जी,
हैं।
कोई और
नहीं,
क्वेश्चन हो किसी का? सर का टाइम हो रहा है जाने का।
चलो अगेन
थैंक यू।
वन, थैंक यू वेरी मच
थैंक यू
फॉर
सर,
पेशेंस।
थैंक यू सो मच।
पेशेंस, थैंक यू।